Hi again, everyone. My name is Alvina Ye, and I'm the Executive Director of the Asian Pacific American Labor Alliance, or APALA for short. By way of personal introduction, my family is from Vietnam of Chinese descent, and we're among the many boat people who escaped the Vietnam War. And the work that we do at APALA is very personal to me because of the ability of my mom to get a good union job and for our family to have stability as new immigrants to this country. And that was rare for my family back then, and even more rare now under an increasingly anti-immigrant and anti-worker political atmosphere. APALA is a member-led organization that works to build power for Asian American and Pacific Islander working people. And we do this through our grassroots and civic engagement campaigns around immigrant, racial, and economic justice. You can find more about our work at www.apalanet.org. On our website, we also have worker videos to tell some of the stories of frontline AAPI workers. And you can also contribute to our COVID-19 community fund to help support our most impacted workers during this time. So for today's town hall, I'm really glad that we're hosting this, as it's a great opportunity to shed light on who AAPI workers are, the challenges they face in terms of workplace issues and in income inequality, and to hear about proposed policy solutions. Now, in order to shatter the model minority myth a little bit, we do feel like we need to talk a little bit about who AAPI workers are. So in our first slide, you'll see that our AAPI working population has grown nearly 10 times faster than our white counterparts. On the next slide, you'll see that despite that growth, there is large income inequality, both at the highest and lowest ends of the labor market. And for example, that means that Asian Americans and Pacific Islanders are overrepresented in occupations of folks making under $200,000 per year in industries such as food preparation, personal care, and transportation, but are also overrepresented in occupations making over $100,000 a year in occupations such as sales, management, computers, and math. Our community is also overrepresented in the frontline medical community. So while we make up approximately 6% of the US workforce, we are overrepresented in industries where, for example, 9% of registered nurses are Asian. And the percentage is even higher in harder hit areas like in New York, where Asian nurses are 13%, in New Jersey, where it's 18%, and in California, where it's 34%. This pandemic is very, very personal to our members whose industries have been decimated, who have been limited from receiving support from the federal government, who have faced long-time health and systemic inequities that have made this pandemic all the more devastating. Now, we know that this pandemic has underscored what we've always known, that Black, Indigenous, people of color, women, immigrants are some of the most undervalued and vulnerable in our country. And that especially as Black folks, that state-sanctioned violence further impacts vulnerable communities. On the next slide, you'll see that we have 2 million AAPI frontline workers who risk their personal health on the jobs and personal safety in a time of increased racism and xenophobia towards Asian Americans during this pandemic. APAs have also seen an increase in hate crimes as they head to work as doctors, nurses, farm workers, supermarket workers, and other essential workers. And you'll hear some of those stories today. For those that are not in a union job, more than 1 in 4 private sector workers don't earn a single paid sick day. And among those that do, most don't earn enough sick time to quarantine for the recommended 14 days or to recover from COVID-19. So other data around unemployment. So while nationally, Asian Americans and Pacific Islanders have typically had the lowest rates of unemployment in the US, new data does show that Asian Americans are being disproportionately impacted by unemployment related to COVID-19. For example, in New York, AAPIs represent nearly 13% of New York's unemployment claims for the week ending April 11th, despite being just 9% of the state's population. In that same week, the state also saw an increase of unemployment filings among AAPIs that they were highest among any racial group. So contrary to the economic narrative that the model minority suggests that we are all doing well, AAPI communities are acutely impacted by the long-term impacts of unemployment. For example, in 2008, AAPIs had the highest rates of long-term unemployment of any racial or ethnic group in 2011. Now, we know there's no normal to return to, but there is a tremendous opportunity that as workers, as the ones that produce economic value for our country, we have the opportunity to demand what the conditions should look like for how our country reopens and how it cares for those that live here. There's many opportunities for us to demand that change, including some of the policy proposals that we'll hear later on. Another way that we can make our voices heard is by participating in the census and by making sure that all of our communities are counted and we have the data that we need to tell the stories like I just did about the economic and health impacts and disparities to our community. So I will turn it over to our speakers later to shed some light on some of those challenges and policy solutions, but right now I'm going to turn it over to Representative Grace Meng from New York. She's someone who's been a champion for members like our Apollo New York chapter locally and for AAPI communities and workers across the country. So without further ado, I'll send it over to Representative Grace Meng.
Hi, everyone. I hope this is working. This is Congresswoman Grace Meng, and thank you to Alvina for the introduction, and more importantly, for sharing a lot of the information that many of us might have known, and even if we do, we certainly don't hear it enough. And we certainly don't talk about it enough in mainstream circles. So I'm really glad to have this opportunity. And I really want to thank all of you for inviting me here today as we discuss how we can strengthen the rights of workers, especially members of our Asian American, Native Hawaiian, and Pacific Islander communities. I also want to thank Greg Orton, National Director of AANHPI, and Christine Chen, Executive Director of APIA Vote, for this opportunity to address this issue, and for your unwavering leadership on so many issues that affect our communities. As you all know, the COVID-19 crisis has brought upon indescribable heartache for so many, especially those who have experienced loss of a loved one, loss of employment, etc. As cities emerge from quarantine and we are rebuilding our economies, it's vital that we recognize the socioeconomic and racial divides within our existing systems, including labor, criminal justice, education, healthcare, and housing. This pandemic has highlighted the inadequacies of these systems and the disproportionate impacts on AAPI, Black, Latino, and Native American communities. And I saw this right in my own district here in Queens, New York, where while the whole country in many parts were being told to safely quarantine, that was a luxury that many people in our communities could not afford. And so since the early days of this pandemic, even before the virus actually hit the United States, we had already started seeing the deeply harmful stereotyping and scapegoating of AAPIs, which led to the rise and still today continuation of discrimination, racism, and hatred against AAPIs and their businesses. That's one of the reasons why I introduced a resolution condemning anti-Asian sentiment related to COVID-19, which had nearly 150 co-sponsors and over 500 endorsing organizations. I want to extend my deepest thanks to Greg and AANHPI, who was super instrumental in the work to advocate for this resolution, as well as countless other supporting organizations across the nation. And in light of what's going on around the country today, I also want to say that the supporting organizations and members of this resolution were not just Asian American. For example, Congresswoman Karen Bass, who's chair of the Black Caucus in Congress, was amongst the first to publicly support and denounce anti-Asian sentiment. We had nationwide groups like NAACP, National Urban League, to Black student associations on college campuses who were standing up for our communities. And so, you know, during this pandemic, we have seen that It's brought urgency to the need to improve language access for our communities from the very beginning. As the government, from the CDC to our local agencies, were giving out information, oftentimes our communities literally did not get the necessary information from when to quarantine, how to safely quarantine, etc. And so that's one of the reasons why I introduced legislation, the Language Access Act, to require federal agencies to translate COVID-19 related written materials in at least 19 languages. I just felt like if we were to take healing and protection seriously, we needed to at least get the information out to everyone, especially those most vulnerable and who needed to hear it. So many are playing a role to help combat the virus, especially our essential employees who have been working tirelessly each and every day to provide the critical services that we need. As Alvina mentioned, it's over 2 million AAPIs who are working on the front lines. I don't think the mainstream society fully appreciates that number. They are working in healthcare, law enforcement, first responders, transit workers, as we see on the screen, supermarkets, and so many other service industries. 17% of healthcare workers in the US and 1 in 4 doctors are actually immigrants. So although workers are the fastest growing working population in the United States, our contributions are often minimized to a single demographic that fails to reveal income inequalities even within our community, and even wider disparities for women workers. And yes, the wage gap affects women, but this impact is magnified as it also harms our children and families and our economy as a whole. But first, we have to pull back the curtain of invisibility on our own community to unveil the disaggregated data and thereby the urgent need. The presented data will say that Asian American AAPI women working full-time are typically paid on average 90 cents for every dollar paid to their white male counterparts. We know, however, disaggregated data reveals that Southeast Asian and Pacific Islander women, for example, experience large pay gaps, making as low as 50 cents to the white male dollar. So we need to do more also to protect immigrant workers, strengthen pathways for employment-based immigration, ensure equal pay, and improve labor standards. Just recently, it was reported that about half of New York's working class immigrants have lost their jobs as a result of the coronavirus. For undocumented immigrants, the economic divide is even greater and dire as they're unable to even access the help that Congress has provided, from unemployment insurance, stimulus checks, or cash assistance. And so that's one reason why I introduced the COVID-19 Employment Authorization Document Extension Act, which would automatically extend the length of work permits during this pandemic. This bill would especially help those immigrants who are working on the front lines, literally saving our lives right now. And I was really proud to help pass the HEROES Act in the House, which addresses many of these issues. It would, for example, allow immigrants who use individual taxpayer identification numbers to be able to receive the stimulus payments as well, because they haven't been able to get a penny thus far. And it would make these funds retroactive. And it would extend unemployment insurance through next January to provide relief for those who have struggled after losing their jobs. So we have to protect these measures in the next stimulus relief bill. Also, as a member of the House Appropriations Committee, I proudly supported over $3 billion for Workforce Innovation and Opportunity Act programs to prepare workers for good jobs with fair wages. There are various pieces of critical legislation to protect and strengthen workers that the House has passed and the Senate must take up. The PRO Act, Raise the Wage Act, Paycheck Fairness Act. And while the work that lies ahead to enact policy reforms may seem overwhelming, especially during this crisis, I firmly believe that we can rebuild a stronger and better America as long as we stay united in our values and our priorities. So I really want to thank In-Capital Policy Platform participants and organizers for embracing these challenges ahead. You've known of the problems. Nothing that has kind of manifested itself during coronavirus has surprised any of you. But let's seize this momentum to make sure that we are doing all that we can to help our AAPI workers. So thank you, everyone. I hope that you stay safe and healthy, and I hope that we can meet in person soon again one day. Take care.
Thank you so much, Representative Ming, and thank you for your leadership and the political courage that it takes to continue to push for the economic relief that our communities need. At this time is going to be my personal favorite part of the town hall is hearing from worker voices to hear the stories of how they've been impacted and what sorts of reforms that they would like to see as workers. Our first speaker is going to be Nicanora Montenegro. Nicanora is a Filipina in-home support services provider based in San Diego, California, and she also is a member of United Domestic Workers of America, UDW-AFSCME. As an in-home support services provider, she takes care of our most vulnerable folks in our community who are the most at risk of COVID-19. I'm now going to turn it over to Nicanora to tell her story.
Hi, good afternoon, everyone. Good evening. Good evening, everyone. Yes, I am Nicanora Montenegro, and I am an in-home supportive service provider. I am a Filipino, and I just would like to share with you a little of my story before I tell you about the stories or issues and concerns of homemakers and caregivers here in America. I started taking care of my mom in 2004. She was physically disabled, and she has a lot of problems, physical problems, and at the same time taking care of my sister who is developmentally challenged. And taking care of the two of them at that time in 2004 was actually, later on when my mom's health started deteriorating, I could only have 2 hours of sleep a day. You may not believe it, but at that time, I was doing peritoneal dialysis on my mom at home. My mom's heart cannot even handle the hemodialysis machine, so we have to do the peritoneal, but her heart still cannot handle the peritoneal dialysis machine. That I have to do the peritoneal dialysis manually 4 times a day. And the schedule is 12 midnight, 6 in the morning, 12 noon, 6 in the afternoon every day. So you could imagine that 2 hours of session every dialysis, that's 8-hour session every day. At the same time, I was caring for my sister who is developmentally challenged. And at that particular moment, if you will take a look at that, I really have to give up my job because I cannot, at that time, with 2 hours of sleep a day, I cannot do any job at all. And my only sleeping time is 3 o'clock to 5 o'clock in the morning. That's my window for sleeping. And if I have to do first aid on her on that hours, then that means forget that sleep in that particular day. It was really tough and difficult, but I'm still happy that we have the in-home supportive service, the IHSS program, because with that, at least I was getting paid a little from the government. And that's one of the benefits that I got. However, the pay is still not enough because one of the major concern of caregivers and home care providers they are actually underpaid. My mom passed away in 2014. So now I only have my sister I'm taking care of. I have a little time since 2014 that I became more and more active with my union and other activities. But like taking care of my sister, she's developmentally challenged, but she is only given 4 hours of care a day. That means I take care of her 24 hours a day, but I am only paid 4 hours a day. Now that is an example of underpayment. And yet it is already, we're already being paid under the IHSS program of the government. How much more the other caregivers who are undocumented, and even if they are documented, but they are not under the IHSS programs. It's difficult to be a domestic worker. It's difficult to be a caregiver. And yet, if we take a look at it, there's always two sides of a coin. One side are the vulnerable people that we need to take care for, and the other side are the people who take care of them. And these sides of the coin cannot be separated. So anything that is done against the vulnerable members is a stab against the provider. And anything that is done on the provider is a stab actually on the people that care. That's why I'm always saying that anything that is being done on any side, it hurts both sides. It is at this moment when COVID-19 came, and that's what I had been harping on when I had been interviewed by the Union Tribune and other media. Always I had been telling them that caregivers, home care workers, had been considered invisible people. We were always left behind. Nobody seems to notice and care for us because we do not work for a company that can easily be seen. Because we work in individual homes, that's why people don't seem to realize and remember that we work very hard inside the home, and yet we are not seen. And because of that, we are left behind. So I really hammered on stating that home care providers and caregivers are actually not only essential workers, but we are frontliners as well, because we take care of these people who are at risk, at highest risk in terms of getting not only COVID-19, but also other infectious diseases. In other words, this situation has been highlighted by COVID-19, but actually it has been existing in the past that we are frontliners and we are essential workers. And yet our work is not expendable because we cannot. How can the vulnerable members of our community survive without the caregivers? This is also the main reason why we need more protection, because most caregivers are underpaid and they are overworked and there is no overtime. In fact, even if I am paid under the in-home supportive service, we do not have actually overtime until our union fought for it, for us to have overtime. But for those who do not have or do not belong to a union, there is no overtime pay. Even if they work on wee hours in the evening, those are some of the abuses. And ergonomically, usually, when people work at home as caregivers, there are no meal breaks. And of course, no work, no pay.
Nicanora, thank you so much. I know that there's so much that home healthcare workers have to deal with, and we could go on and do a whole town hall about that.
I know. Thank
you so much for sharing your story. I'm gonna move on to our next worker, and we'll have time during Q&A for more time. But our next worker is Andy Huang, and Andy is a laid-off hotel worker from Boston, Massachusetts, and a member of Unite Here Local 26. She's been working at the Westin Boston waterfront for 13 years, and ever since she and all her coworkers lost their jobs in March, Andy has been helping other workers apply for unemployment, food assistance, and other needs. Andy has also been volunteering with the Chinese Progressive Association, and she'll be joined by Karen Chen, the ED of the Chinese Progressive Association, for translation help. Andy and Karen, please welcome.
Hello. 好嘈咁啊！係大家好我名係叫 Andy。頭先Vivian 已經解釋咗我係工會嘅員工，但係我由1998年嚟到美國之後咧，第一份工係喺 Power One 嗰度做工。咁做咗1年幾之後咧，間廠就嗰陣時啲經濟係將嗰啲廠房全部搬晒去中國或者去咗墨西哥，所以我嗰陣時就失業。咁公司淨係俾翻2個星期嘅遣散費俾我就lay off。
So my name is Candy Huang, and thank you, Avina, for the introduction. I am a hotel worker now, and a member of Local 26 Unite Here, and I came to the U.S. in 1990. Actually, my first job in the U.S. was an electronic manufacturing company called Wont, and because of globalization, this company moved to Mexico and China, and I was left with only 2 weeks of severance pay.
經過前進會嘅幫手阿 Kellen 以前嚟幫我哋咧組織我哋去遊行咧，所以我哋得到係2年嘅培訓同埋失業可以領到2年。然之後我喺藥廠做工，但係感覺到個待遇係唔公平嘅，同埋其他方面都係唔合理嘅。
I worked with Karen at the Chinese Progressive Association. At that time, they were able to help us fight for 2 years of retraining. And after retraining, I was able to work for a manufacturing company that makes medical supplies. But the treatment there was really, really bad. And the boss was very unreasonable.
所以有工會同冇工會嘅分別咧，等我2006年我揾到工會嘅嗰個酒店做工咧，我就知道咗有工會同冇工會嘅分別。有工會我哋可以有公平嘅待遇，仲有好嘅醫療，同埋唔使擔心我哋嘅醫療係要俾好多錢出去俾 deductible 啊同 copay， 我哋嘅工資得到提高，所以咧嗰陣時候我都可以有錢可以買到間屋，就唔使生活穩定咗，就唔需要擔心有加租啊呢樣其他方面嘅嘢。
So I saw a huge difference when I joined Local 26 in a union hotel in Western Waterfront, and that was in 2006. With the union and the collective voice, we were treated more fairly. I have a health insurance. I didn't have to worry about copay or deductible. I have much higher wages, and I was able to buy my own home. So I have had a much more stable life, and I don't have to worry about rent increases, which a lot of people worry about now.
我嘅先生係一個啱啱退休個餐館工人，咁同佢哋相比咧，我哋係好幸福，佢哋係好差嘅，做工嘅條件好差，佢每個星期係要做60個鐘，每一個月係出糧1次，有時佢哋公司係冇其他冇好好嘅待遇，有時呢個老細咧仲要拖佢哋嘅工資。
So my husband now is retired, but he was a restaurant worker, and his working conditions very different from mine. He has to work 60 hours a week, and there's very little worker protection. He gets pay once a month, and there are times that actually the boss would pay them late. There's no benefits.
係因為啲老細咧咁拖佢哋嘅人工咧，又影響到好多嗰啲啲人喺餐館做工嗰啲人嘅家庭，所以咧佢哋面對嘅挑戰係好大嘅，每個月又要俾屋租啦，又要有其他嘅雜費嘅支出啦，所以俾佢哋係好大嘅問題。
So many restaurant workers, faced with wage theft, and it's challenging not just for the worker, but also for the entire family. Almost every month you have to worry about paying rent and being able to bring food to the table.
俾我而家個最擔心嘅問題咧，就係而家酒店雖然開始列 open， 但係咧我哋係驚好多啲seniority 低嗰啲人咧係冇工返，所以我哋好擔心我哋嘅醫療咧仲會唔會繼續。
So right now, with the pandemic, we're working towards reopening. It's hope for some people, but there's worry for a lot of workers because the workers with low seniority may not be able to go back to work. And then there's the question around health insurance.
我哋個公司，我哋代表談判嘅咧，就係同公司邀請申請我哋可以俾多6個月嘅醫療保險俾我哋。
So right now I'm working with my coworkers to demand our employer to pay for additional 6 months of health insurance.
我哋大家都知道咧，嗰個 pandemic 嗰個600蚊嘅補助失業金係去到7月25號就停，所以俾好多 基層嘅工人咧，佢哋家庭會如果完咗之後係會好大嘅影響。就算有工開咧好咧，都好多人都係冇工返嘅。
You know, right now, what's some policy that would help us is that, you know, on July 25th, a lot of people will lose unemployment, will lose a lot of stability. That impacts a lot of working families.
俾我哋係好支持嗰啲移民嘅嚟到美國係得到政府嘅福利，因為咧我哋中國人喺我哋額頭係唔知道邊個係有身份，邊個係冇身份嘅。如果冇咗其他冇身份嘅人去支持我哋去爭取一樣嘢係好難嘅，我哋嘅爭取係更加困難嘅，所以我哋係可以聯合埋其他嗰啲人一齊去爭取。
So I think Andy was also referring to the HEROES Act and why it was so important about, you know, the components on unemployment and health insurance. And then also she said that, you know, any policies that support immigrant and especially undocumented immigrants, that will be really important as, you know, if they're impacted, we're impacted, you know, people's forehead doesn't say, you know, if you're documented or not undocumented. You can see someone who's Chinese or who's, you know, who's Asian.
仲有一樣係好緊要嘅咧，就係呢個房屋嘅穩定問題，係因為咧我哋之前向麻省係要求我哋係拖延我哋嘅屋租，去到8月15號咧就會到期，但係而家我哋想爭取到1年。
So another thing that's really important to people's lives is housing stability. Massachusetts was able to win eviction moratorium, but that expires on August 15th. We're also working for on a policy that actually extends the eviction moratorium and other tenant protections to a year from after the emergency order is lifted.
Thank you.
Okay, 多謝 Andy, 多謝 Karen 幫我哋翻譯. Thank you, Andy, and thank you, Karen, for helping us translate. And thank you for uplifting so much important points, especially in terms of the legislation of the people that are being left out of care. The next person that I'm going to introduce is Evan Santoso. Evan is a student at UCLA. He's a rising senior, and he's also a summer intern at the UCLA Labor Center. Like many families during this pandemic, Evan's family is dealing with the loss of their father, who was an Amazon warehouse worker and contracted COVID-19. Evan, thank you so much for taking time out of your day and joining us on our panel.
Thank you, Alvina. I wanted to begin by expressing my gratitude towards NHPI for providing me with this opportunity to share my dad's story at this event and to everyone attending today. I believe this fight for economic justice and worker rights in this time of emergency is paramount to a better future for the AAPI community, for this nation, and for this world. With that, I want to start my story by quickly flashing back to my childhood in my home in sunny Southern California. Time and time again, my father, Harry Santoso, would advance his black knight across the cardboard chessboard, look up at me, and say, "Checkmate, but don't worry, Evan, you're getting better." My victorious opponent sitting across the table was my role model. And on April 12, 2020, he was taken away from me and from this world due to COVID-19. In the late 1970s, my father, an ethnic Chinese, immigrated from Indonesia to Los Angeles in search of better opportunities and a better life. He gained his college degrees, worked hard in various office and warehouse jobs. My mom, also a Chinese Indonesian immigrant, gained hers as well and became a pharmacist technician. My parents sacrificed everything to create a brighter future for my brother and me. Their hard work has enabled me to pursue my undergraduate degree at UCLA for the past 3 years. Starting in late 2018, in order to support our family financially, my father became a part-time worker, seasonal warehouse work at Amazon, which shifts either very late at night or very early in the morning, but was laid off several times due to seasonal demand. His job was to load boxes and help monitor the quality of shipments under strict time quotas, which was tedious and stressful. The one silver lining, however, was that he liked to exercise and walk, which the job required lots of. This past March, he was laid off, but a couple weeks later, he was rehired once again as part of Amazon's recent mass wave of hires to accommodate for the increased shipment of goods during this pandemic. Many stores were forced to close, but Amazon never did. At the time, there was, and still is, an apparent lack of safety precautions and shortcomings. For example, the company did not provide enough gloves and masks to their warehouse workers, and face coverings were initially not mandatory. On top of that, social distancing was and is still loosely enforced. Within a 2-week time span, he started developing symptoms, his health quickly deteriorated, and soon passed away. While my mother was caring for him, she was also became infected with COVID-19, but thankfully recovered several weeks later. As these events rapidly unfolded before me, I was left distraught, seeking answers to an endless flood of questions like, how is my family supposed to live without the best father? And why was this virus so brutal? And how can I help ensure the health and safety of other essential and warehouse workers? And so at this lowest point of my life, I found solace in remembering my father's core values that he instilled in my brother and me throughout our upbringing. He'd always told us that we should view adversities in life as opportunities, lessons to become better and stronger people. And so when I was grieving alongside my family and attempting to make sense of the cascade of uncertainty shoved into my hands, his voice of reason and inspiration provided me with clarity and strength. As my family continues to cope with our loss, I share this to commemorate my father's life story. But I have also realized that my father's passing is connected to a larger pressing issue in our present day society, and that is the lack of worker safeguards set to curtail the virus's spread. Therefore, I tell this life narrative to inspire change, to encourage better occupational safety and health standards across all industries. Additionally, it is imperative that we protect and strengthen collective bargaining rights because workers deserve a better quality of life. These matters are especially crucial to protect workers and save lives both during and after this time of emergency. We must all continue to do our part to conquer this virus, take care of our families and each other, and fight for workers' rights. And so in closing, during my school spring break, just a couple of weeks before he passed away, I played a casual game of chess with my dad, not knowing this would be our last game together. Throughout the game, he gained a steady edge on me. However, in the end, I advanced my black knight across the cardboard chessboard, looked up at him and said, "Checkmate, good game, Dad." In hindsight, I realized that achieving that victory in our final game, despite being on the verge of losing, was a testament that his words will forever impact and inspire me to continue his legacy, and that is to never stop fighting amidst the hardships in life. And so now, to do so, we should all stand up for workers' rights together in solidarity and in unity. Thank you.
Thank you, Evan, for sharing that really beautiful story about your father and for talking about why we need dramatic policy changes to help protect our workers and families. And thank you again, Andy and Nicanora, for also sharing your very deeply personal stories. So next, I do want to turn it to Sangyan Chamorro, who is the Executive Director of the National Asian Pacific American Women's Forum. Sangyan's going to be talking about something that we all definitely know to be true, is in whatever situation we're in, no matter how disproportionately our communities are affected, women on top of that are even more disproportionately affected. And so Sangyan's going to talk a lot about that. Thank you, Sangyan.
Thank you, Elvina. Thank you for everyone that's on this panel and everyone who's tuned in. Yeah, so, you know, we have some slides here and I was like, oh, we should just present them as Representative Meng's talking, because Representative Meng did cover some of this. So I'll kind of quickly touch on the statistics and then kind of talk about how Asian American women, what we do to make up the lost wages and what are the other things that contribute to wage disparities as well. So like Representative Meng said, Asian American women working full time make an average of 90 cents to every dollar a white man makes. And in the policy space in DC, they've created this thing called Equal Pay Day. And it's essentially, you know, after a full year, how many more months and days does a woman need to work in order to make what a white man makes in 1 year, right? And so like the general Equal Pay Day usually falls in March or April, but Asian American women, AAPI Women's Equal Pay Day has always fallen earlier. And this is because, you know, we make 90 cents to a dollar. And so people would say like, oh, look, even the women do so much better. You know, Asian American women do so much better than all the other women. But obviously when you disaggregate the data, as Representative Meng pointed out, that this is far from the truth. And I think this is really important for us to understand and provide nuance when we're talking about the economic situation of Asian Americans, right? Where you know, again, like going back to this idea that we are the model minority, that, I often get people say, well, aren't you all lawyers and doctors and engineers, right? Well, we are not. And as you heard in the different stories of the workers that just went before me, as well as you will see in this next slide, that, the gap, that there is a bit of gap when it comes to wages within specific ethnic groups. So if you could go to the next slide, yeah. So you can see that South Asian women make 82 cents to a white man's dollar, and Southeast Asian women make 73. And within that group, Hmong women make 61 cents to a white man's dollar, and Cambodian American women make 57 cents to a white man's dollar. And the Pacific Islander community on average makes 64 cents to a white man's dollar. And so on the next slide, you'll see sort of the chart of all of our ethnicity disaggregated. So go to the next slide. You can see there's a really wide range, right? And so while we've marked early February as Asian American Equal Pay Day to say, Asian American, it takes a year and 2 months for an Asian American woman to make what a white man makes in $1. The reality is for a Nepalese American, actually that equal pay day doesn't fall till much later on in the year, as they make half of what a white man makes. So essentially, it would be in December, right? Like it takes another full year for them to make. So I do want to point out that huge disparity even within what we call the Asian American Pacific Islander community, that like we're not a monolith, and that our communities have these really wide varying gaps when it comes to gender wage gap. And then the next slide, there's some studies that are done by state, and Alaska as a state for Asian American women has the widest wage gap at 54 cents to a white man's dollar. And so how do we make up this lost wage, right? So, people struggle, and you heard the stories of Nicanora and NDS. They're talking about their life, Nicanora talking about sleeping 2 hours a day, right? Like they're working really long hours. They're working multiple jobs. They're also working well past retirement age. And what we need to keep in mind is that especially, a woman, but in families, the amount of money that a family is able to make does determine the quality of life. And for women, when we surveyed Asian American women voters, they did say that, their economic status, their current economic status does play a factor in when and if and how they decide to parent, right? So people do family planning based on this, and also the quality of life we're able to provide their children really does depend on how much we're able to make. So it is really crucial that we address the wage gap as we address the overall economic issue around low wage and increasing wages for workers. I do think that we cannot lose sight of the fact that even in various sectors, that women tend to make lower than men in most jobs that are similar or equal. And going back to talking about COVID-19, as you saw, 2 million of frontline workers, as Representative Meng and Alvina pointed out earlier, are Asian Americans, and over 50% of them are women, right? And Asian American women are working in the front lines in hospitality, as you heard Andy speak, and in healthcare and home care, as Nicanora was speaking about, and even as Evan was talking about, working in retail, right? So Asian Americans are in all sorts of the front lines, everything from healthcare workers, janitors, to nurses that work in the hospital setting, to small business owners, right, who are dealing with customers on a day-to-day basis. And so the risk of Asian Americans in general, and especially Asian American women, being exposed to workplace safety issues, especially around COVID-19, is very high. And I saw that there's a question here about, how do we ensure that employees are protected, under OSHA, especially under current circumstances of COVID. And I think that, like what COVID-19 has done is really magnified the problem that we've known that exists, right? The fact that immigrants cannot have access to affordable health care. There's a 5-year bar on immigrants accessing public aid, which includes Medicaid. And so it makes accessing healthcare really difficult. And we've seen that over and over again, as we heard from workers too, that, I personally know of Korean Americans who are undocumented who are afraid to go get tested because they're unsure of the financial cost and burden of what that means because they don't have health insurance, right? So all of these factors play into not only are we getting paid less, but those not getting health care, as Andy was talking about fighting for health care when they go back to work, right? Like this is real for people, that there are people who are going to go back to jobs with, and until we have a vaccine, people are being exposed without a guarantee that they're going to have healthcare coverage to help pay for treatment and testing, right? And so I think all of these things are interconnected, and so we have to see it as a full picture. And having healthcare access is really important. And so one of the things that we work on at NAPOF that we're really proud of having led with 250 organizations is the introduction of the HEAL Act, which Representative Meng is a sponsor of. We had it introduced in the House, and it had its first ever Senate introduction in March, in the middle of a pandemic, that too, in the Senate. And basically what this bill would do, it would remove the 5-year bar for immigrants to access public aid, including Medicaid, to be able to have affordable health care. And it also includes, there's a portion that does include undocumented folks to be able to buy into the exchange as well. And so, we believe that, as the virus is spreading around the country, we can see that the virus doesn't discriminate, but our healthcare system does, right? And all of these play into the factor of worker protection, workers' health, and quality of life of workers. And, I would be remiss to not mention here, if I didn't mention that, one of the other major factors that Asian American women experience in the workplace is sexual harassment, right? That Asian American women, whether it's housekeepers, it's tech workers, lawyers. I mean, I've heard from the range of women who are in their line of work about harassment, sexual harassment that happens to them. And so that also, becomes a hazard for us. And as we talked about earlier with COVID-19 and the racism that's on the rise, we've also seen that Asian American women are 2 to 3 times more likely to experience harassment than Asian American men due to COVID-19. And, NAPOF is an organization that builds power with Asian American women and girls across the country. And we hear firsthand stories from our members about, more folks are afraid to go back to work for fear of being exposed to harassment than they are of the virus. I mean, this is how serious the harassment issue is. And so that is something else to take into consideration. So to wrap up really quickly, couple of recommendations here. We need to restore the Equal Employment Opportunity Commission, right? The EEOC. Under this current administration, it's been gutted. And we need to restore EEOC and collect wage gap data that includes data disaggregated data by race and gender. And so, NAPOF is a huge supporter of collecting disaggregated data for the reasons that are obvious that you saw in the slides that we showed earlier. And we're also supporters of the Paycheck Fairness Act, right, which is passed in the House but not in the Senate. And this would essentially protect retaliation, employees from retaliation for colleagues discussing salaries, and would prohibit employers from screening job applicants based on salary history. And of course, we also support, and we all should support, workplace policies and public policies that protect families, such as paid leave, right? Like, it took a pandemic and all of a sudden we have paid leave. Wow, that was quick, right? And many of us have been fighting in this space for paid family leave for a very long time. And we need to make this the norm, not the exception. So those are the recommendations. NAPAF has a pretty lengthy report on Asian Americans AAPI wage gap. And so if you're interested, I will post the link to accessing that document into the chat box so that you can have access to it. And it kind of details why AAPI women face wage gap and what that looks like in different communities, as well as some of these recommendations.
Thank you so much, Song-Yan. And you've heard us talk a lot about the policy platform. So our last speaker before we go into Q&A is going to be Christina Romines, who is the program manager of APALA, to talk specifically about some of those policy recommendations. Right after that, we're going into Q&A. So if you have a question, feel free to chat it in the box. And if not, then on Facebook, you can chat it there, and we'll try to pick up some questions and answer them live. Christina?
Thanks, Alvina, and thanks everyone for sharing your stories on this call. On the screen here, I've put the link for where you can find the full 2020 NCAPA policy platform. Today, we're mainly talking about workers, but as you've heard, issues of immigration and issues of healthcare and housing, these are critically important to workers and to our communities as well. So I encourage you to check out that link, and I'll just go over some of the recommendations for our section. The first and the biggest one is that all workers should have rights with no exceptions. So the recommendation is to expand the National Labor Relations Act, the Fair Labor Standards Act, and other federal labor laws to all workers, regardless of industry, employer size, worker classification type. And I wanted to bring attention to this specifically because since the passage of these laws in 1935 and 1938, respectively, low-wage workers who are predominantly workers of color have been excluded from basic but critical labor standards, such as the right to form a union, to earn a minimum wage, and to receive overtime pay. Loopholes for tipped workers, farm workers, home care workers in the original legislation were created intentionally to exclude Black and brown workers for the maintenance of a white economic and social hierarchy, and that exists today. So think about what was going on in the country in the mid-1930s. We are still living under that legacy. And it's time to close those loopholes, because as we look at what our labor market going forward, today major corporations are further eroding our labor standards in industries, especially with high numbers of AAPI workers and other workers of color, by changing the structure of employers' relationship with workers. In the restaurant, service, gig, and tech industries, corporations have used multi-layered contracting, staffing, or temp firms, franchising, and employee misclassification as independent contractors to shift the risks and cost onto workers so that they themselves can reap billions in profits. That's why our second recommendation is around shifting the burden and risk of enforcing these labor standards that don't cover everyone intentionally from workers to employers. This is to protect AAPI immigrant workers whose legal status or for other reasons can make them targets of discrimination, intimidation, and wage theft. So we must advocate for policies at the federal, state, and local level that protect workers from retaliation, from forced arbitration. We need to ensure that they have time to bring their wage theft claims forward and other claims through lengthening and suspending statutes of limitations. I see in the questions or in the chat that there's a question around how long how the system was built sort of intentionally along racial lines, and how we build back better. And I believe that is by directly calling these policies what they are, and that's racist. We need to bring attention to our lawmakers that we can't be beholden to these laws that were passed more than 80 years ago, because it is long past the time that they are changed. So I think really being explicit and really demanding those things makes it clear. So next, we need to strengthen AAPI workers' ability to unionize and negotiate for better wages, and by providing stronger deterrence and fairer remedies for workers who face retaliation, discrimination, and employer interference in general. Finally, we need to make sure employers are being compensated fairly by supporting a living wage of at least $15 an hour, and bringing employers, workers, and government together in industry-wide bargaining tables to negotiate wages and other benefits. Briefly, I'll just talk about some of the things that we're calling for in response to the COVID pandemic. For essential workers, they need benefits and compensation. We need to provide hero or premium pay and childcare benefits to the wide range of people who are essential workers, and not just who folks think are essential. So we need to compensate them for their risk and ensure that they can keep coming back to work, because they are the ones who are keeping us safe. However, we also know that we need many more protections for those who are working now. Right now, the Occupational Safety and Health Administration, or OSHA, does not have a standard around infectious diseases, which is what COVID-19 is. They need to issue a temporary one immediately and work to ensure that a permanent one is issued as well. This standard needs to be enforceable, and it needs to cover all workers. Similarly, we need to require the CDC and the National Institute for Occupational Safety and Health, or NIOSH, to track and investigate work-related COVID-19 infections and make recommendations on needed actions or guidance to protect employees. OSHA should also forbid employers from retaliating against workers for reporting infection control problems to the employer, to any public authority, to the media, or even on social media platforms. That is something that has been happening, and we need protections for that. We need more expanded access to paid family medical and sick leave to ensure that folks can take the time to care for themselves or their loved ones. And finally, much more needs to be done to address the employment crisis. As Alvina mentioned at the top, unemployment is something that impacts our communities in unique ways. And so we would also support Rep. Jayapal's Paycheck Guarantee Act to ensure that more folks are getting the support that they need in this time. And so I will leave it there. So we have a little bit of time for questions. Thank you.
Thank you so much, Christina, and thank you for going over extensively some of the highlights from the policy platform. I mean, this is by no means a document that's finished. Now that it's been created, we intend to use it and advocate for it regularly. I see in Facebook chat we have a question from Megan. Megan asks, are there candidates running for election anywhere in the US we should be supporting that have adopted this policy platform? Megan, in Kappa, API Vote, and all the organizations on this call, well, Apollo is not, but many of the organizations are nonpartisan organizations, and so we can't exactly share specific candidates, but what we can say is to do some research of trusted community groups that you follow or friends that you follow locally, and see if they have put out voter guides, and just to see if there are other folks that are aligned with your values that support particular candidates. But that's a really great question. We have shared this platform with members of Congress, and many of them have vocalized support for many of the platform issues. Are there any other questions out there? I see Jacqueline has a question. Which of these can be pushed locally versus federally? Jacqueline, I assume you mean as a part of what Christina presented. And Christina, do you want to jump in here and answer that?
Yes, so there are some states that are that have more than what we can sort of expect at the federal level. And so one like super specific example that I wanted to provide is around the recommendation around shifting the burden and risk of enforcing labor standards. There is a commission, and I forget the name of it, I apologize, I'm not a Californian myself, but in California, a commission was put forward to proactively go after industries and employers that were high violation, because right now the system as it exists, like, depends on workers to come forward, and as we know, like, we lack some of the resources to do that. And so I think it's time that our enforcement agencies had some teeth, and we're a little bit, no, we're extremely proactive in their response.
If I could add to that, there are also organizations that are like coalitions of state or organizations that work on some of these bills. So for example, like Family Values at Work is an organization that's made up of members that run state level and local ordinances around paid sick leave, family leave, wage increases, that sort of thing. So if you're interested at the local level, I think I would go check out their website and see if you live in a state where they have a campaign going to support. And CAPA, we're a national coalition, so a lot of the things that are in the platform are kind of targeting, directed at federal policymakers. But obviously, like, any of these things can't, you know, and as it goes with kind of the way our government's been, that many states are taking it upon themselves to do these things, to implement some of these things. So, like, for example, Illinois just passed a Paycheck Fairness Act years ago. That's something we're trying to push at the federal level. We don't have it there, but in Illinois, it is illegal to ask someone their salary history, right? So we're making it happen. You know, there are organizations and other folks, not, you know, that especially people who work in family with Family Values at Work that work locally. And I know, like, local AFL, state AFL-CIOs also participate in these campaigns. So I would look at, like, their, you know, depending on what state you're in, to look up some of their websites to see if there are local initiatives.
I'll pause here. We don't have any more questions that I see as of yet. And if anyone has questions either for Christina, Sangyan, Andy, Nicanor, or Evan, please let us know. And while we wait to see if there's maybe one more question, I will wrap up to say, I mean, this is really exciting, this week of town halls that we're doing leading up to the AAPI presidential town hall on Saturday. I mean, this is really all created to have a platform for all the specific myriad of issues that impact AAPI communities, and all of the policy recommendations we need, and all of the conversations we need to have with elected officials, and how we as organizers can hold them accountable to the things that our community needs. You know, I'll just shout out the census again as another great way to participate in civic engagement. And you can fill out your census by going to census2020.gov. I did it myself for the very first time with my daughter, not for the first time, but the first time with my newborn daughter. And it was super easy, took less than 5 minutes. Let me check the chat, looks like there might be one more question. This meeting will be available for viewing, and for the folks that have those details, I'll have them shout that out in the chat so you can see where you'll be able to see everything. Also, I'm sure if you go to apivote.org, if there are any archival materials, you'll be able to see that. It is being recorded, so I'm sure it'll be posted somewhere. And it looks like those are all the questions that we have. Thank you again so much, Andy, Nicanor, and Evan. For the three of you that were on a call, we know that every single person out there has some personal story about how they've been impacted and what they need as workers, and how we need our lawmakers to do better for our community. So thank you so much for sharing your personal stories and being so vulnerable in such a public forum. And we did hear that the video is being recorded and will be posted on API Vote's Facebook page shortly. And with that, thank you so much, everybody, and we'll see you online this week for the town halls and on the streets as we continue to organize. Thanks so much.